This is Dr. James with Helpmommy.com, and today we're going to talk about teething. So a baby can get their first tooth anytime from the time they're 2 months old until they're about 18 months old. And what you need to know as a parent is it doesn't matter when in that span they get their teeth, it's completely normal. About half of the babies will have a tooth by the time they're 6 months old. What you need to realize is that when a baby gets a tooth, that tooth is going to fall out in proportion to when they get it. So if a baby gets a first tooth when they're 2 months old, that baby's going to likely lose their first tooth when they're 4. If they don't get their first tooth till they're like 16, 17 months old, they may not lose that first tooth until they're like 7 to 8, maybe even 9 years old. And that's completely fine. In fact, I actually prefer babies to get their teeth later because I like those baby teeth to be in as long as possible because kids don't brush their teeth very well. If we're going to get a cavity, I'd prefer it to be in a baby tooth than in a permanent tooth. Those permanent teeth have to last a lot longer. Every baby is going to get a tooth. I don't think there's been a single baby that's ever died from teething. But man, I feel like I've almost lost some parents because they were just freaking out about the fact that their baby was fussy or wanting to chew on stuff. It's going to happen. Not all things that a baby goes through are you going to be able to take away as a parent. They are going to have to teeth. It's just an uncomfortable thing. Some babies will get their teeth and you never even know it. They just slide in and you're like, all of a sudden you're surprised. They were never fussy. They never drooled. They just have a tooth. Other babies may chew on things and drool. They may have some occasional cough. They may cry. Their gums may be swollen for sometimes weeks, maybe even a month before the tooth comes through. They work really hard at their teeth. But that's not something that you can take away. It's something that they have to go through. Now, are there ways that you can make them more comfortable? Sure. There's all kinds of things. There are teethers. The other day I saw this one that looked really cool that the baby was loving. Sit there and it looked like a little bee and had a little rubbery thing and it vibrated. Baby was just chewing on that thing like it was liquid gold. Other babies, they'll chew on their pacifier. They'll chew on their finger. They'll chew on their hands. There's all kinds of teething little toys that they can chew on. I really like to take a washcloth and to wet the corner of the washcloth and put it in the freezer and let them chew on that. The cloth has texture and it has cold. And then once they use that, it's pretty easy to just throw it in the washing machine and clean it. And when my little one was teething, I might have 4 or 5 of these in the freezer just to grab at any point. Using medicine, we could do it. You could use Tylenol, you could use ibuprofen, but is it really worth it? I mean, everything has benefits and side effects and things like that. I guess if you're really suffering and your baby's really suffering, it's fine to use some Tylenol or Motrin. But there's not anything really beyond that. I'm not a fan of the teething gels. There's a rare condition called methemoglobinemia that can happen when you use these numbing gels for the teeth. I'm not a real big fan of teething tablets. The active ingredient in there is belladonna. If they get the dose wrong, it can actually be toxic to babies. There's even been a death reported from this. This is completely unregulated. These homeopathic medicines, they don't have to be tested for effectiveness. They don't have to be tested for safety. They are considered natural. And I have some problems with that, especially when you look at the active ingredients and you find out what they are. When belladonna is an extract from a plant called deadly nightshade, doesn't make you feel real warm and cuddly about using it with your baby. But the important thing is to know that they all get through it. They all end up with their teeth and, they may be fussy, but it's not your job to take away all the fussy. I know we'd like to, and we need some peace and quiet, but you're not going to be able to take it all away. Babies are going to cry. We can't take all their cries away. And babies are going to sometimes be uncomfortable with teething. And they will come through, and they will be fine, and they will get teeth. And so just know, as they're teething and they're fussy, that it's just part of it. It's not your job as a parent to make teething go away. Teething has to happen. Good luck.